We want to welcome everyone to Mount Sinai. My name is Ruth Mendivelso, onboarding specialist with the Department of Volunteer Services at Mount Sinai Hospital. Joining us today is Ashley Isman, one of our employee health services who works on the health clearances for all volunteers. She'll provide tips and more information about the health requirements for a smooth process. Please remain on mute. And lastly, please hold off your questions until we have reached the Q&A portion of this info session. These are the onboarding topics we'll be going over today: the VC's live portal account, the initial health clearance toxicology screening, the background screening, managing references, the educational modules, and the Q&A portion will be last. Everyone here should have access to their VC's live portal account. The care coordinators did let me know that everyone here has their onboarding materials released to them about 2 weeks ago. So you already have access to your onboarding requirements and hopefully has began the process. So we are now going to log in to the VC's portal account with the test account I have. If you have trouble logging into your portal account for some reason, please email us at volunteer@mountsinai.org and we will further assist you. If you forgot your password, please make sure to click on Forgot Password. So it takes a few seconds to log in. And once you're logged in, you have already noticed that you have two checklists. You have a general checklist, which is volunteer 18+, and then you have the initial health clearance checklist, which is just a breakdown of the health requirements. As you have already noticed, we have menu tabs on top of your homepage, which is the home frequent asked questions. You just click here to return to your checklist. The My Information, there is a summary information where you could upload your profile picture, consent form for media release, view messages, and manage your references. The documents, oops, I didn't mean to click that. So the documents tab is just a list of blank forms for you to download that pertains to your onboarding checklist. The message tab here is to submit a toxicology request form, and we will go over that shortly along with the upload health clearance documents menu tab. The manage my reference menu tab is where you're going to manage your reference. We will go over that shortly too, but that's where you could resend or add a new reference. My uploaded documents menu tab, you could view all the documents you have uploaded and the statuses. And the last two is to change password or sign up. Now, the first requirement on your general volunteer 18+ checklist is the health clearance. It says, please click on the incomplete tab in the health clearance checklist to access the required health forms. Now, you could click on any of the incomplete links on each of the health requirements here, or, which I find it to be easier, is to navigate over to upload health clearance documents and click on initial health requirements. It'll bring you to the same page where it lists all the health requirements information. Once you're in this page, is the health clearance for volunteers instructions. It lists all the requirements you need to complete. The first one is asking you to click here to view the health clearance information. So you're going to click on this link, and it'll bring you to a PDF document. The first two are guidelines to each of the health requirements. And if you scroll to page 4, you will reach the EHS non-employee clearance form. These are the Mount Sinai forms. So it's actually 2 pages. For the EHS non-employee clearance form, you're going to print your name, enter your date of birth, phone number, email, the department that you'll be volunteering for. You're going to check off volunteer. You're going to check off the facility, which will be Mount Sinai Hospital. And the clearance requirements 1 through 9 is completed by your primary doctor or any health provider. And they will complete both pages. They will sign, date, and stamp the form. So the stamp is required for these 2-page EHS non-employee clearance form. So right now, I just want to let you guys know for number 6, influenza, also known as the flu shot documentation, since it's currently the new flu vaccine is not available, you're going to leave number 6 blank. And once everything else is complete, you're going to upload it to your Visas account. Okay, so to upload it to your Visas account, you're going to scan both pages, save it as one PDF file, and then you're going to return to the Visas portal account to upload the form. And once you return to this page, you're going to make sure the attachment type says completed immunization requirement for new non-employee health care personnel form. So you're going to make sure that attachment type is selected. You're going to click on the box here to locate the file that you saved, and you're going to click upload. So going back to number 6, the reason why we're leaving this blank, the flu shot documentation, is because, again, the new vaccine is not available right now, but we have been granted permission from Employee Health Services for the care volunteers to upload these forms without number 6 completed, so that you guys could be granted conditional health clearance. That means that you will have until October 1st to submit the new flu shot documentation. Okay? So that means that once the new flu vaccine is available at your doctor's office or clinics in your neighborhood like CVS, you're going to upload that documentation to your Visas portal account. So you don't want to leave this for last minute, like October 1st, to complete and upload. You just want to check. It might be available like late August, early September. So you want to upload that new flu shot documentation by returning to your Visas account, returning to this page, and changing the attachment type to flu vaccine documentation. Okay, so once you get the new flu vaccine, you're going to upload the documentation, changing the attachment type to flu vaccine documentation, locate the file that you saved as a PDF, and click upload. So once you submit the new flu vaccine documentation, Employee Health Services will review and extend your health clearance. The health clearance does not just involve the 2-page form. It actually involves more than that. So you will also need to complete your toxicology test. So everyone here should have received by now an email from us with the subject line, your drug screen Q passport. The email contains instruction how to schedule your toxicology test at a Quest Diagnostic location. If you have not received the email from us and it's been more than 3 business days, please send us a message within your Visas profile by selecting message and then toxicology request. So over here in your menu tabs on your Visas account, you will click on message and then click on toxicology request form. And once you're on this page, you're going to complete the fields in the message box and then click submit. We will receive a notification and follow up with you. The email, your drug screen Q passport, that everyone should have received by now, it looks like this. It will have the subject line, your drug screen Q passport, with the attachment and the instructions how to schedule your appointment. And at your appointment, you have to bring the attached form with you and your photo ID. If you have not received that email, please let me know or send us an email at volunteerdeb@mountsinai.org. The toxicology results are sent directly to Employee Health Services. So once Employee Health Services have all the health requirements, they will review and process your health clearance. Since everyone here are care volunteers, everyone here has to complete the OSHA questionnaire form. So that's number 4. So you're going to click here to download the OSHA questionnaire. And it's a 2-page self-assessment form. So you're going to complete both pages entirely, except for the part where it says to be signed by the physician examiner. This you're going to leave blank. Employee Health Services will sign off. So again, you're going to need to complete the 2-page form, the EHS non-employee clearance form. Upload it without number 6 information because we're not in flu season right now. You're going to complete your toxicology screening. So make that appointment as soon as possible if you haven't already. And you're going to complete the OSHA questionnaire. Where you're going to upload is the OSHA questionnaire. You're going to upload the EHS non-employee clearance form to your Visas account. And when the new flu vaccine is available, you're going to upload that documentation as well. Okay, I know this is a lot of information. Again, this is recorded, so you could play it back once it's available to you. And if you have any questions during the Q&A portion, me and Ashley will be happy to answer. So I'm going back to the health forms. And I'm going to turn it over to Ashley Eastman, who's here with us, so she could provide more guidelines and tips on how to complete this form successfully.
Thank you, Ruth. And thanks to everyone joining and offering your time to volunteer with us. As Ashley said, I'm one of the nurses with Employee Health, so we are responsible for medically clearing all the volunteers at Mount Sinai. I know Ruth's going to open up a Q&A at the end, like she said, which is your guys' free-for-all to ask us anything you want on the medical stuff, etc. But I want to point out a few things on this health clearance form that hold people up a lot of times. I want to look at this number 2 here, this tuberculosis section. There's a lot of verbiage, a lot of wording going on. So I just want to break it down nice and simple. You guys have 2 options for this tuberculosis screening, essentially. That TST line, if you can highlight, Ruth, there's TST number 1, TST number 2. Those are tuberculin skin tests or PPD skin tests. You'll also be hearing them called. So you have to do 2 of them. Now, the time frame requirements for those are in the parentheses there if you're doing this option. See TST number 1 to the right, Ruth, within 3 months of start date. And then TST number 2, you can do another PPD 1 week after number 1 is done. Or if you have one, just by chance, if you have a PPD within the last year, you could submit that for TST number 2 for that line. So I know the timing is tricky, so I wanted to point this out. This is if you guys are doing this PPD skin test option. This is your first option. I will be honest, this is a bit time consuming, the PPD skin test option. Your doctor can do these. CVS Minute Clinic does these as well, but it is time consuming because you have to have the PPD placed in your forearm and then go back to the same place to have it read 2 to 3 days later. It will take up time. A lot of volunteers choose the second option, which is that quantiferon gold. That's a blood test. So that's just a blood test, one and done. And it has to be, as it says there in the parentheses to the right, within 3 months of your start date for volunteering. The chest x-ray highlight there, that is only if you have ever had a positive skin test or a positive quantiferon gold blood test in your lifetime. That's when the chest x-ray option comes into play, and that chest x-ray has to be within the last year. So it's not too often that people will qualify for the chest x-ray option. So it's either the skin test option or the blood test option you guys want to pick from. And if you have questions on this stuff, can you highlight the health forms email, Ruth, up above? You guys can always reach us there anytime and ask health questions if you're not sure on what steps to do. Right there, volunteer health forms at mountsinai.org. Email us anytime there. And I just want to skip to the hepatitis B section, Ruth, at number 5. Yeah, thank you so much. So hepatitis B, you have 3 options here as it reads, yeah? Documentation of a completed series, which is that first line, vaccine number 1, 2, 3, right there going across, or a positive titer, hepatitis B surface antibody titer. That's a blood test to check for antibodies. Or a signed declination, which if you want to decline, I can send you the form if you email health forms, because showing hepatitis B immunity is optional at the end of the day. You don't have to show any of it. Hepatitis B is spread blood and bodily fluids. So just take into consideration, the environment you'll be in. We encourage it, of course, but it technically is optional. So just do 1, 2, or 3. Just choose between the 3 options, and then you guys will be good there. It gets a little confusing when sometimes you give me vaccines and then the doctor for some reason checks the antibody titer. It makes it a little confusing because we have to go with the most recent item because timing matters with hepatitis B. So just make it easier for you guys and just choose 1, 2, or 3 for hepatitis B, okay? And then lastly, that number 9, it's a yes, no question, guys. A lot of doctors miss it. If you have the opportunity to check your health forms, before uploading them, sometimes people give me perfect health forms, and this number 9 is not answered, and it unfortunately holds things up for such a small thing. So I just wanted to point that out. I'll hand it back to you, Ruth. Thank you.
Thank you, Ashley. I'm just gonna unpin you. Okay, so we're gonna move along with the rest of the requirements. So these are the frequent asked questions for medical clearance. I submitted my health form, but notice the section is still marked as incomplete. Please know that it will take up to 2 weeks once the submitted health form is reviewed and approved by Employee Health Service. If you haven't received an update after 2 weeks, send us an email at volunteer@mountsinai.org so that we may follow up on your behalf. So in the case of the care volunteers who are submitting the health forms without the new flu shot information, you don't need to reach out to us if it's been 2 weeks. I'm going to be monitoring the health forms you upload to your Visas account and the new flu shot documentation you're going to upload to your Visas account. So I'll be in touch with Employee Health Services, Ashley. When you have uploaded, you could email me and say, hey, I uploaded it, and I'll take note, and then I'll be in communication with EHS. How do I get a Q passport? The Q passport will be sent via email with a list of instructions to schedule your appointment to your nearest Quest Diagnostic branch. Once you receive the Q passport email, you have 1 month from the day you received it before it expires. So everyone here should have that email, should have at least scheduled it. Please do not schedule the appointment after the month that you receive the email, because then it will be considered expired and we have to place a new order. Do I need to submit the toxicology results to Volunteer DEP or EHS? No, Quest Diagnostic will send the lab results to Employee Health Services for their review. No further action needs to be taken. For all health-related inquiries, please contact Employee Health Services at volunteerhealthforms@mountsinai.org. Moving along, the next requirement is a resume, which was attached to the application you submitted. So those are reviewed and approved. And on your checklist, it should say complete. The next requirement is the corporate screening background check. So for here, you're going to click on the link for instructions. Then once you're on this page, you're going to click on the link on the first step. And it's going to bring you to this one PDF document. On this one PDF document, you're going to click on the link on step 1. I'm going to do it as a new tab and leave the PDF open. Once you're on the corporate screening website, this is an outside entity, you're going to enter the promotional code. So the promotional code is listed on the PDF instruction document. You're going to copy and paste the promotional code. Click continue. And then you're going to create an account. You're going to complete all the fields requested here from you. You're going to enter your email. You're going to create a password for the ID number and confirm the ID number. That means entering your social security number twice. Then you're going to click register. After you click register, they're going to ask you to reconfirm your personal information, digitally sign off the policies and terms for the background check, and then you're going to submit your background check. Once you submit your background check, it will be in processing phase. It could take up to 5 business days or more, depending if you lived outside of the state or they're, looking into something specific and might take more than 5 business days. We will receive, the Department of Volunteer Services will receive the background check clearance. Once we have that clearance, we will apply it to your Visas account, and then your checklist will update to complete. So if you haven't submitted your background check, please do so as soon as possible. because it has been taking more than 5 business days, and we want to make sure that we get the clearance on time. Frequent asked questions for the background screening. Is there a fee to complete the background screening? There is no fee as long as you apply that promotional code. How long does it take for the background screening to complete? It takes about 5 business days. And what do I do if I have issues submitting the background screening? You could send us an email at volunteer@mountsinai.org, or you could contact corporate screening themselves. On the PDF, there is their email address and their phone number. It's best to call. I've heard that calling over email works best. Sometimes there is issues in submitting the background check or creating the account. They will be best to assist you with that. Okay. Next are reference checks. You need 2 references to pass the requirement. So if it still says pending, it could be because we haven't heard back from one or both references. So to manage your references, you're going to click on the menu tab on your Visa's portal account, Manage My References. And it will list the references you provided in your application. So for example, it says one of my references was completed, but I'm missing one because it says pending completion. So you have access to resend this reference. So you're going to click on Edit. You're going to check off Resend Reference and click Save. If you feel like you don't want to use that reference anymore and you know someone else who could complete the reference sooner, you're going to click on Add New. Enter the fields, the name, title, relationship, phone, email, organization, and then you're going to click Save. And after you click Save, it will send an email to the new reference. You want to allow it a few hours for it to be sent and received. You want to check in with your reference that they have received it in their inbox folder or their spam folder, because we also have heard that it lands on the spam folder. Now, this is the only way for you to manage your references. If you are having trouble adding a new reference or resending a reference, please email us at volunteer.. Again, you need 2 references completed. We approve the survey that the reference will be completing. And after that, if both references are complete, the checklist should be updated to complete. Next is the confidentiality statement. You're going to click here for instructions. The confidentiality statement instructions are listed here. You're going to download the form. It's 2 pages. You're going to read the statement carefully, and on the second page, you're going to print your name, you're going to sign it, you're going to date it, and for employer, you're going to write Mount Sinai. After you complete this section, you're going to scan both pages together and upload both pages together as one PDF file. So when you return to this section for the confidentiality statement requirement, you don't need to change the attachment type because there's only one listed. You're going to locate the file that you saved and click upload. And then it will be transferred to the Department of Volunteer Services to review. And if it's completed successfully, they will approve it and the checklist will update to complete. If it's rejected, we email you a rejection email listing why it was rejected, and then you have to resubmit it again with the corrections. So most of the time it's rejected is because they've only uploaded the second page, not both pages, or they forgot to write Mount Sinai for employer. So you want to make sure both pages are uploaded, and for employer, it says Mount Sinai. Next are education materials. These are 5 trainings that you will complete right from your Visa's portal account. Some are videos, some are reading materials, and for each training, there's a quiz at the end. And for the quiz, you could take the quiz as many times as you want until you have successfully answered all the questions correctly. And this is real-time status, meaning that after you complete the quiz and you return home, the status updates to complete. Just like how you see here for HIPAA, it says complete. Just to show you real quick how fire safety looks like. Fire safety is actually a video. So you're going to click start. You're gonna watch the video from beginning to end, and then you're gonna click next. And then you get the first question for the quiz. And then you're gonna click next until you're done. It will let you know if you pass or not. And if you pass, you click home, you click done, you click home, and then it should update to complete just like how it is here for HIPAA. I have another example as well for infection prevention. It says complete. Now, you want to set time aside for these trainings because it does require some time to read and review and watch the videos. So please make sure to start the trainings if you haven't already tonight or the weekend. And last but not least is the international personnel clearance. If on the application you selected no for if you are a US citizen or green card holder, if you selected no, you'll be going through a international personnel clearance. The International Personnel Department reviews and process the international personnel clearance. They will be in contact with you after the application is approved. So they might already been in contact with you already. They will email you a list of requirements they need to review. And once you submit those documents, it probably will include like passport or visa documentations, I-94, etc. They will review and then they will email Department of Volunteer Services with the final decision if we are approving the person to move along. They will send us the clearance, we will apply it to your account, and it will say complete. For those who have selected yes, you are a US citizen or green card holder, you already have noticed that for this requirement, it says complete. And before we go on to the Q&A portion, just want to let you guys know about the My Uploaded Documents menu tab. So I'm just going to click on it. And for the My Uploaded Documents menu tab, it lists all the documents you uploaded, the date you uploaded it, and the statuses. So here's an example. I uploaded the OSHA questionnaire. It's still pending. Pending means it hasn't been transferred yet. The resume here, you can see that it's been approved. The confidentiality statement that I did upload is still pending review. If you notice that some of the forms that you uploaded has been pending more than, let's say, 5 business days, please email us so we could look into it. But if it's an EHS documentation that you have uploaded, it would either say pending or transferred. Pending meaning it hasn't been transferred yet. Transfer means it was transferred to Employee Health Services. If it says rejected, you will have gotten that email with why it was rejected, and then you have to resubmit. If it says duplicate, it's because we're just listing it as a duplicate copy that we already received the original. So that's how my uploaded document feature is. It's actually a new feature for the Visas portal account. So hopefully it has been helpful in reconfirming that you have uploaded the documents. Here's another example. Here you could see the rejected status for one of the documents this volunteer uploaded. You can see transfer and approved. So these are reminders that all care volunteers assignments have to complete the OSHA questionnaire form. The deadline to complete all onboarding requirements is August 16, and I believe August 16 is the day of your some training with the care coordinators, I believe. So the deadline to complete all onboarding requirements is August 16. This means every single requirement on your checklist has to be submitted and hopefully been approved at that time, with the exception of the new flu shot documentation. And the new flu shot documentation deadline is October 1st. So what that means is that while we have been granted conditional clearance for your health forms that you uploaded, this means that once the new flu vaccine is available at your doctor's office or CVS or any other urgent care clinics in your area, you're going to get the new flu vaccine and upload the documentation to your Visas portal account, and you have until October 1st. Please do not leave it till last minute. I will be managing this. You could email me that I have uploaded it, and I'll be in communication with Employee Health Services. There's still many ways to still contact with us. Please email us at volunteerdeb@mountsinai.org. If you have specific questions about the CARE program, shifts, uniforms, etc., please email the CARE coordinators at care_volunteers@mountsinai.org. Please call us at the number listed here and dial 1, and I'll be answering any onboarding clearance questions. And then we also have one-on-one session for drop-in Zoom office hours, no appointment needed. Mondays, Wednesdays, and Fridays is from 10 to 11. Tuesdays and Thursdays is from 2 to 3. And again, if you have any health specific related inquiries, you can email Employee Health Services at volunteerhealthforms@mountsinai.org. So I'm going to stop the recording now. Just give me a second.